Hi, my name is Julianna, and today Daniela and I will be speaking about borderline personality disorder. Before we begin, we would just like to do a land acknowledgement, and this is for Toronto, where the Dish with One Spoon territory is located, as well as X University. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Our agenda for today will include the following: an introduction, what is borderline personality disorder, statistics, risk factors, what are the warning signs, and comorbidity and borderline personality disorder. Then I'll pass it over to Daniela, who will go over treatment, misconceptions about borderline personality disorder, coping with borderline personality disorder, supporting someone living with borderline personality disorder, supporting a client, resources, and important points to remember. To begin, borderline personality disorder, or BPD, is a mental health disorder that can be characterized by having difficulties regulating emotion. People who experience BPD feel emotions intensely and for longer periods of time than others. After an emotionally triggering event, they have a hard time returning to a stable baseline after. There are many difficulties that come along with a disorder, but many people with this disorder get better over time with treatment such as therapy. Borderline personality disorder is a mental health condition that causes an ongoing pattern of varying moods, self-image, and behavior. Many times these symptoms result in impulsive actions and can cause problems in relationships. Individuals with BPD may experience intense episodes of anger, depression, and anxiety that can last anywhere from a few hours to days. These individuals have difficulty regulating and handling their emotions and controlling their impulses. They can also be highly sensitive to their surroundings and can react with intense emotions in response to small changes in their environment. It is very common for individuals with BPD to also have other mental health conditions such as depression, substance use disorders, PTSD, and anxiety. It is sometimes difficult to diagnose BPD because symptoms of the co-occurring disorder can hide or mimic the symptoms of BPD. More on this will be discussed later. About 1 to 2% of the general population has borderline personality disorder. You are 5 times more likely to develop BPD if a close family member, like a sibling or parent, also has the condition. You also have a higher risk of developing BPD if a close family member has an impulse control disorder, like a substance use disorder or antisocial personality disorder. Women are much more likely to be diagnosed than men. In fact, 75% of people diagnosed with BPD are women. BPD is often missed or misdiagnosed. Around 40% of people with the disorder have previously been misdiagnosed with other disorders such as bipolar disorder or major depressive disorder. Almost half of people who are diagnosed with BPD will not meet the criteria for a diagnosis just 2 years later. And 10 years later, over 88% of people who were once diagnosed no longer meet the criteria for diagnosis. Some factors related to personality development can increase the risk of developing the disorder and includes hereditary disposition. You may be at a higher risk of developing the disorder if a close relative has the same or similar disorder. Traumatic childhood. Many individuals with BPD report being sexually or physically abused or neglected during childhood. Some reported having lost or been separated from their parent or caregiver when they were younger. They've also have had parents with substance misuse or other mental health disorders. In addition, also being exposed to hostile conflict and unstable family relationships can contribute to the diagnosis of BPD. Lastly are brain changes. Research has shown that the changes in the brain that are associated with emotional regulation, impulsivity, and aggression can contribute to development of the disorder. In addition, brain chemicals that regulate mood, such as serotonin, may not function properly in these individuals. Common symptoms of BPD include intense bouts of anger, depression, or anxiety, wide mood swings lasting from a few hours to a few days, emptiness associated with loneliness and neediness, paranoid thoughts and dissociative states, self-image that can change depending on whom the person is with, impulsive and harmful behaviors such as problematic use of substances, self-harm, suicidal thoughts or suicide attempts, and lastly, impulsive and emotionally volatile behaviors. BPD typically coexist with depression, anxiety, and substance misuse. Symptoms of these conditions may lead the clinician to miss the diagnosis of borderline personality disorder entirely. As previously discussed, many people are not appropriately diagnosed with borderline personality disorder because their other mental health disorders can hide or mimic the symptoms of BPD. Regardless of the other comorbidities that exist, BPD needs to be addressed as a distinct and unique disorder, as it usually requires a more intensive approach. Therapy is an essential part of managing BPD, and you must work with a therapist who understands comorbidities and who specializes in BPD to develop an effective treatment plan for you. Therapy is most essential as there are currently no medications approved by the FDA to treat borderline personality disorder. However,
Now we will discuss treatment. There are different treatment options for BPD. However, it is important that if needed and wanted, you receive treatment for other mental illnesses that may be comorbid with BPD. The first treatment option we'll discuss is psychotherapy. There are different types of therapy that can be beneficial in providing the tools to cope with BPD. Often the process will be changed to meet the needs of the client, but it will assist in benefiting daily functioning, managing emotions, observing behaviors and its relation to emotions, and learning about the condition. Some examples of types of psychotherapy that may be offered include dialectical behavioral therapy, or DBT, or schema-focused therapy. The next treatment option is medications. There is not an approved medication for BPD. However, many individuals take medications to improve some of the symptoms or comorbid mental illnesses such as depression, anxiety, impulsiveness, or aggression. There are various misconceptions about BPD which can harm those living with the condition. These misconceptions can perpetuate harmful stereotypes and stigmas, as well as lead to a lack of understanding about the mental illness. Both of these can impact how people living with BPD are viewed. We will discuss a few misconceptions that individuals living with the mental illness face. The first being, BPD cannot be treated. There are treatment options that will help someone cope with a mental illness. There are a variety of psychotherapy modalities that have been shown to benefit BPD clients. These can reduce symptoms and help individuals living with mental illness. The next is, the behaviors of those living with BPD are attention-seeking and should be ignored. This misconception is one of the more dangerous ones. Impulsive behaviors that lead to harm are not attention-seeking, but signs that someone may need help. Therefore, it is important not to ignore them, but to talk to individuals, as giving attention to individuals showing signs of distress can save lives. And finally, living with BPD is a choice. BPD is not a choice. Without understanding through lived experience, people cannot know what the mental illness is like and how it can impact emotions. BPD often comes from childhood trauma, and it is important to deconstruct this misconception as it perpetuates harmful notions. Coping with borderline personality disorder. There are different ways that people living with BPD can cope with the mental illness in their day-to-day lives. Similar to other mental illnesses, not all coping methods will prove beneficial for everyone, but we will discuss a few that can be important and helpful. The first being to reach out. While it can be difficult to talk to someone about feelings or experiences, reaching out to talk to a trusted individual can be beneficial. It can provide a safe space to express how you're feeling. If you do not want to talk to someone you know personally, there is also an option to reach out to a mental health professional. You can also journal your moods. Jotting down what your moods are, when they occur, and any other relevant information around a mood change can help. It can assist you in noticing patterns in mood changes so that you can determine what your triggers are. It can also help you get some of your feelings on paper. Plan ahead. Planning ahead for when symptoms get worse can be beneficial. This plan can contain information in the event of a crisis, what you can do, how someone can support you, and any other relevant information that will help. It can also be beneficial to create a box for these moments with some of your favorite things to provide you with a distraction or comfort. Peer support. Peer support can be beneficial as it is a group of people with similar lived experiences. Support groups have been shown to be beneficial for individuals living with BPD. And finally, take care of your physical health. Looking after physical health can help with emotions. It can be important to watch sleeping and eating habits, exercise, and time spent outside. There are different ways that someone can support an individual living with BPD, and we'll go over a few of these ways. The first being to educate yourself about BPD. It can be beneficial to learn about the mental illness. It will provide you tools to appropriately respond to behaviors in a way that will benefit the individual, as you can better understand where they may be coming from. It's also important to show respect, remain judgment-free, and be trusting. It can be important to show these to an individual with BPD. As we've seen in the misconception slide, there are various myths that can harm individuals living with mental illness. As such, many people need someone to show them respect and abstain from judgment. By being trustworthy, it can allow the individual to feel safe coming to you. You can also help them reach out to a professional. It can be difficult for many people to recognize that they should get help, and even when they do, they may not know where to go, or stigma may stop them. It can be important to support them in finding professional help that can provide them with the tools that they need to cope with BPD. Take self-harm behavior seriously. As seen in the misconception slides, often people ignore these signs or view them as a call for attention. However, they are not, and it can be very key to notice these behaviors and discuss them with the individual. A question such as, "I've noticed you've been acting differently lately, would you like to discuss what's going on?" can be beneficial as it provides them the space to open up safely without forcing them into a conversation they may not be prepared to have. You can remind them that you're there for them as well. And finally, most important, you must take care of yourself. Establish boundaries, engage in self-care, and reach out to someone can all be important methods to look after your own mental health. There are different ways practitioners can support clients living with BPD. However, there are 3 main points to consider. The first being to work on a trusting relationship. While this is important to any working relationship with any client, it can be significant in working with someone living with BPD in order to have meaningful conversations. Due to the connection of difficulties with trusting and BPD, it can be better to start with creating trust and a connection with a client before challenging any negative behaviors. Remind them that you're there to support them, but remember that trust is more shown through actions and words. You can also push for validation. Validating can be key as it can show that you're listening and acknowledging without agreeing to harmful behaviors. Statements like, "You have the right to your own feelings or opinions," can help a client feel validated and show that you're trying to better understand how they view the world. And finally, create boundaries with behaviors. Providing support and validation to individuals living with BPD is significant. However, it is also important to balance it with establishing boundaries, especially around behaviors that are not appropriate. Now we'll go over resources. The most important thing to take away from this video is that there's supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. We will conclude this video with some important points to remember. BPD is a mental illness that can be characterized by having difficulties regulating emotion. It can result in an ongoing pattern of varying moods, self-images, and behaviors. There are different risk factors that can increase the risk of developing the mental illness, such as hereditary predisposition, traumatic childhood, and brain changes. There are different warning signs of BPD, which have been discussed in this presentation. And finally, BPD can typically coexist with other mental illnesses, including depression, anxiety, or substance abuse. To continue with some important points to remember, there are different treatment options for BPD. Typically, psychotherapy is used, however, medications can also be beneficial. As well, misconceptions about the mental illness perpetuate many harmful notions and can lead to a lack of understanding about BPD. Individuals can cope with BPD in different ways, and such methods can be beneficial to living with the mental illness. People can support others living with BPD, although it is important that they look after their own mental health first. And finally, practitioners can support clients in different ways, but there are 3 key points to consider as discussed in this presentation. That concludes this presentation on borderline personality disorder. Thank you for watching.